If sitting fires up your sciatica, whether it's at work, driving, even at dinner time, let's figure out why. The two main culprits are the discs in your spine and the piriformis muscle deep within your hip. The trick is knowing which one is talking to you, because the fix can be totally different. Let's go. The way you sit affects both conditions, and here's how. When you don't sit upright and start to slouch, it pushes the disc back against the spinal cord, increasing stress and inflammation. This same poor posture places pressure on the tailbone, overloads the piriformis, and weakens the glutes. Terrible, right? We're going to perform some simple quick checks right at your desk right now to decide if it's more disc or piriformis. I'm going to start my quick check with good posture sitting at the edge of my seat, and then you first extend the affected leg as far as it'll go, and then I'm going to slump down. If that causes more pain shooting down the leg or in the back, it points more to disc. Step 2, take the affected leg and to place it across the other knee. Hold the ankle and gently press down on the knee, sit up straight, and now I'm going to slowly extend the leg that's on the floor just by a few inches. Doing so increases the stretch on the piriformis, and if that causes increased pain, zinging, or even a little dull ache more than the first test, it's leaning more towards piriformis. All you gotta do is take a short break at the top of every hour and perform these quick exercises. Sit at the edge of your seat, stick your knee and ankle out, and we're going to perform a seated nerve glide. You're going to flex forward your head and foot and extend in a rhythmic pattern. Let me scoot back so you can see that. Flex, extend, flex, extend. Then we want to loosen up the actual spine. I'm going to take my hands on my hips, coming to the edge of the seat, and I'm going to extend and flex, doing a seated cat-camel. Now ideally, this works even better standing, just depends if you have time during your work hour. So if I stand, flex and extend, flex and extend, getting movement for about 5 to 10 repetitions. Then come to the desk and you're going to put pressure going down while extending the back up to do a standing prone extension. After about 5 to 10 seconds, relax. After another 5 to 10 repetitions of that, you want to make sure in your seat you stick a good lumbar support roll and always cinch your back against that roll. Doing so allows the pressure to be off of the spine and you can get back to work. Now, say you truly can't get up because you're in the middle of a meeting, I can still do the prone extension while seated. I come to the edge of the seat and I either use the handle or the seat itself to put pressure down while lifting my chest and my body up towards the sky. You can even tip the chin up a little bit and then relax and extend up 5 to 10 seconds. After that, for an additional bonus, I can turn and place my hands on the desk and gently extend the seat back, dip my head between my arms, and get a gentle traction and extension in my spine. Come back up, take a moment to rest, and then roll back. With piriformis, we also want to take breaks throughout the day, but we're going to start with the seated 99 hip switch. And in this exercise, usually you'll see people show you how to do it on the floor. But who wants to get dirty? I'm at work. Instead, we're going to modify it. And especially if you're in a lot of pain, this is easier on the body. I'm going to start with the knee movement. I'm going to shift them towards one side and then slowly lean forward a little bit. And I'm going to actually use my hand to cheat a little and put a little stretch to one side and then to take a moment and reset. The knees go first. I lean forward a little bit to the opposing side and a little gentle hold and back. It doesn't seem like much, but this is enough to stretch and loosen a very tight muscle when you're always sitting in one position stagnant. Then I'm going to come up and perform a standing hip opener. Typically you'll see it done this way. Again, trying to open up space, making sure you're standing tall. I'm going to raise a thigh and rotate it as far as I can, and spend a few seconds with a little pressure opening up the pelvis. But I don't know if you're able to raise your leg this high. Instead, slight bend in the knee, rotate while keeping the rest of the body straight, and place it just a few inches off the ground. Now I can stand safely and more comfortably if I'm older or just in a lot of pain. Now again, stretching and holding. You can either have your hand on your hip or on the wall for support, about 30 seconds at a time, and back. And just because you have one side that may be hurting, you want to do it to both sides of the piriformis. Now that relaxes the muscle. What we're going to do right after that is now strengthen and engage a muscle that usually is quiet when it shouldn't be, the glute medius and minimus. If you saw a previous video we did last week, we talked all about these compensations and that you have to engage the glute medius, minimus, and maximus to fix the compensations. If you haven't checked it out, check this link right here and it will really help your progress. So when I sit back down before I start work again, I'm going to take my hand or the desk and I'm going to push and squeeze, doing an isometric contraction. That means pushing without moving and then relaxing. That's it. But you want to really feel your glutes on the side. Push out, squeeze, hold 5 seconds, and then relax. Perform 5 to 10 times on both sides. You're going to feel more engagement and more relaxation in the piriformis area. And the last bonus tip I want to say is that many times patients will really ask me, Doc, is it better to stand? Is it better to sit? I always hear about standing desks. The truth is, no one position is good to be in over 45 minutes to an hour. So I like to do both. Get up, do your work, then do your exercises and move around a little bit. And if you're able to, change your work position so that now I can sit and do the work while giving my back a little more relaxation. And again, another hour goes by, I change my position. So optimally, switching, sitting, standing, even if you have a kneeling chair, just getting some different positions allows your spine and hips not to lock up. That's the key. Post a comment below on which fix helped you the most. And if sitting is your trigger, next, check sleep. What happens at night can undo your day. In this next video coming up, we show you the best positions for sleeping with sciatica, whether it's disc or piriformis syndrome.